On September 8th, 2022, the FDA came out and announced that there have been reports of squamous cell carcinoma and lymphomas found in capsules around implants. So what does this now mean? What can you do about it? And what should you look out for if you have breast implants? My name is Christina. I'm the founder of Size Happy, the admin of the best Facebook group on Facebook, Breast Implant Illness, Rejuvenation, and Education with Christina. And you can also find me on Instagram at I am Size Happy. The big question that I have is, should something that can potentially cause cancer still be on the market? Silicone breast implants were put back on the market back in 2006. 5 years later, in 2011, and I quote, the FDA has been collecting and evaluating information about BIA-ALCL, which stands for Breast Implant Associated Anaplastic Large Cell Lymphoma, which is a cancer of the immune system. Some signs and symptoms of these lymphomas and anything that may be potentially life-threatening include swelling of the breast, pain, lumps, redness, any kind of discharge from the nipples. Basically, if you have any kind of physical pain or physical abnormality of the breast, it doesn't look normal, it doesn't feel normal, then those would be some signs that you should go to your doctor and just get checked out for these cancers. And I'm going to be quoting the source because one, I don't want to get anything wrong, and two, I don't want to misinterpret anything. So I'm just going to read it straight here from the actual announcement off of FDA.gov. And it says, the USDA, Food and Drug Administration, is informing the public about reports of cancers, including squamous cell carcinoma and various lymphomas in the scar tissue, the capsule, that forms around implants. This is why it is so important that when you remove your breast implants, you also get the capsule removed. Now, whether it's done en bloc, which just means you take the implant and the capsule out together in one piece, or whether it's done maybe partially en bloc with a total capsulectomy, which just means after the implant is out and after some of that capsule is out, if there is any remaining capsule left inside you, maybe it's stuck to muscle or stuck to ribs, that your plastic surgeon will either peel it off, scrape it off, cauterize it off, but you're left with a completely clean breast cavity, free of capsule and obviously free of those breast implants. Typically, how you test for these cancers is during your explant or your breast implant removal surgery. Your plastic surgeon should take some of your capsule and any fluid that might be inside of your capsule and send that off to pathology. I don't know the codes to the squamous cell carcinoma, but I do know the code to get tested for BIA-ALCL. It's called the CD30 pathology test. And again, your surgeon will take a piece of the capsule or the whole capsule. I'm not exactly sure the protocol for it. I'm obviously not a doctor or a surgeon, but your surgeon should know exactly what to do and what to send in so that you can get tested for those cells. Currently on the FDA's website, under this announcement, it says if you do not have symptoms, the FDA does not recommend the removal of breast implants because of the safety communication or announcement. Personally, if you're asking me as a patient and somebody who's just gone through breast implant illness, not even a cancer, I personally would feel like if these things are toxic, if they are causing negative impacts to my health, why should I or why would I want to wait until I potentially get something worse and something that I can't reverse? So as a patient and just somebody that advocates for women's health and breast implant illness, I would say, listen to your body and trust your intuition. If you are somebody that is like, I don't want to wait to see if something happens, I want to take care of this now, Awesome. Trust your gut, follow your intuition, look into explanting the right way and the safe way. I have plenty of resources on this channel about explant surgery, what it should look like, how to choose the best explant surgeon. And I also have the Facebook group, which not only has a lot of information about breast implants and breast implant illness, but there's also 10,000 women in there who are talking about their own experiences with breast implant illness, what they're doing to help feel better, all of that. So you have those 2 additional resources by your side to help you during this very scary, unknown journey. And then if you're somebody who's like, I feel fine, I don't see the need to explant or remove my breast implants, again, I support you. That is your body, it's your choice, it's your life, it's your future, it's your health, right? But my job here is to just educate and inform you of the things that are popping up, because it just seems like, especially over the last 5 years, nothing good is coming out of breast implants. I have personally seen them negatively impact so many women's lives and relationships. It's really hard to debate with me how 40+ chemicals and heavy metals implanted inside of a body can be good. If you or somebody you love has breast implants and has maybe complained about swelling, pain, redness, discharge, anything that they feel is abnormal and not right, share this video with them. And if you feel called to, share it inside any other Facebook groups that you might be in, because you seriously never know what bringing forth this information can do for another woman. It is how I myself found out about breast implant illness and found out about breast implants and what they do to the body. And so for all the women who shared their stories before me, thank you. Down below in the description area, I'm going to link this FDA article so that you can kind of read through it yourself. And I'm also going to link the MedWatch link website where you can go and actually report any adverse reactions and adverse effects that you're having with your breast implants into them. And if you have any other questions or concerns about your breast implants or what this all now means, feel free to comment down below, ask me, and then definitely go to the FDA's website and put in breast implants or breast implant illness in the search and just skim through all of the articles that pop up. And I'm not here to scare or shame, I'm simply here to educate and inform. So I hope that this was very helpful in a sense. It's always good to just stay on the up and up with what the FDA is finding, because like I said, new things are just popping up all the time. The restrictions are getting tighter for these breast implants. I mean, there's now a black box warning. Patients must be informed of all the risks associated with breast implants, things that weren't here just a year ago, 5 years ago. This video, if this was helpful, comment down below and please consider subscribing if you aren't already, and I will see you on the next video.